As we in the United States learn more about psychological health and safety, we'll also have to consider additional strategies to address mental health in the workplace. We'll be joined by a mental health professional that's at the forefront of new approaches to an old problem. Up next on this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. Safety at work is more than freedom from physical injury. To be safe, you have to feel safe. Join us each week as we discuss psychologically healthy and safe work in the USA. Well, welcome to this week's episode of the Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to help people figure out how important psychological health and safety is by learning from the lived experiences, research, and expertise of our guests, while at the same time advocating strategies to hopefully reduce harm and minimize vulnerability to work to psychosocial hazards in the American workplace. So in the United States, there are an estimated 350 individuals to every mental health care provider. And that number actually may be overestimated because it includes some folks who are not practicing and others who are taking new customers or new patients. So we have a bit of a lack of access to mental health care across the country. But we also, even where we actually have providers, many of our ways of going about mental health and particularly in the workplace, they could use fresh eyes. They could actually use some fresh approaches. So it's my honor and privilege today to talk to one of those folks who's a provider who's looking at this from a slightly different lens and looking for some new approaches and new thoughts. He's a clinical psychologist, a mental health researcher, and educator by training, and a partner to employees on workplace mental health strategies by trade. I'm looking forward to this conversation. And as I start these podcasts off, each episode, I start off with this question. In this case, so who is Dr. Joe Grasso?
Big question. So I am a clinical psychologist by training, but I am interesting as a clinical psychologist because my focus has historically been more about the macro than the micro. So my training is actually in what's called implementation science and quality improvement, very much a systems view of things. How do we understand how to take what works in the research literature and actually make it effective in real world settings? And so this has you thinking about the whole system that you're implementing it in. Who's going to be implementing it? How does this affect their workflow? How do we measure impact? How do we evaluate programs? Really trying to not just think about how do we treat one specific individual, but how do we implement models of care, models of intervention that can have the greatest chance of having their intended impact by implementing them in this strategic way. And so for me, for most of my postdoctoral training and then my years outside of postdoctoral training, I was focused on integrating mental health services into primary care clinics to address that access issue you mentioned. We know that a lot of people go to care first for their mental health concerns via a primary care provider. And so my interest was in taking this care model from the research literature, this integrating mental health into primary care program, and making it work in real life settings. For me, that often meant the Department of Veterans Affairs. And so that was really a great training ground for me in thinking about systemic organizational approaches to program development and program implementation. When I moved over to Lyra Health, my current employer, which is much more focused on workplace mental health and offering employers both individual care benefits, but also access to organizational supports. You know, I took this organizational lens with me and started to think about, okay, how do we think about all of the ways in which an organization needs to promote a mental health strategy through the ways that they deploy learning and development, through the ways that they develop manager practices, through their corporate policies, even through the ways that they respond to crises. And so even though my career has taken many twists and turns, I've kind of kept this common thread of how do we think about things holistically, organizationally, when we're thinking about how to support individuals.
Well, honestly, as I listen to your description of yourself and your background and your area of study and now your practical application, the word that comes to mind, I had someone bring this up some years ago. You sound like a pracademic. Yeah. So practical approach to academics, because we have, we tend to have folks on either side of that a lot. That academically, they've got, great theory and great ideas about how it might work. And then you have others who they can do it. They can't really explain it all that well, but somehow they're able to do things every single day. And it's good to have folks who can bridge the gap, because I think we get better intentionally when we can bridge the gap. We'll still get better. I mean, we'll stumble our way into, if you keep working at it long enough, it'll probably get better.
Right.
Or we come up with reams and reams and reams of research papers that never really get implemented. But if they did, they'd be great. So.
Right. If only we could just treat the world as if it were a laboratory.
Wouldn't that be wonderful?
Right.
So along those lines, tell me a little bit about your thoughts about the concept or the idea of psychological health and safety. What is that? When you hear that, what comes to mind for you?
When I hear psychological health and safety, I think about employers taking responsibility for the ways in which they can directly affect employee mental health. And so I think about the ISO 45003 standard. That means the environmental factors that shape employee mental health, the interpersonal or social factors that shape employee mental health, and then also the work design factors. So I think a lot of employers think about workplace mental health exclusively in the benefits and programs realm. What benefits do we offer for individual care? What programs do we offer that promote awareness of well-being, or maybe even facilitate individual well-being practices in the workplace, like yoga at work or mindfulness meditation at work? Hey, those are nice, great things. But where I think psychological health and safety comes in is addressing the root cause reasons why work might negatively affect employee mental health, and recognizing that as an employer, you have a lot more direct responsibility than you might realize for employee mental health. There are certain things that are essential, but not sufficient. Individual care benefits, not just for the employee, but for the full family, that address a wide spectrum of need. That is essential, but it's not sufficient for addressing workforce mental health. Same with workplace programs around wellness and well-being promotion. Very helpful, not sufficient for addressing the root cause reasons why people are distressed at work due to things like burnout.
Sure. Yeah. And you mentioned, and rightfully so, the fact that employers, business owners, organizational leadership, however you want to describe them, have a greater responsibility than they sometimes realize or understand. And I also believe they have greater benefits to the organization itself than they understand as well. Because often when mental health comes up, people go to the lagging indicator of the system and try to figure out how many people in their organization have anxiety or depression disorders. And, some of them may. But ultimately, this is not about them. It's about the environment that they are in. It's about taking responsibility and, again, deriving benefit from changing the environment itself and working on the environment itself. And frankly, and I'll get blunt with it, rather than wasting time trying to change people.
Yes.
Because I think there's a lot of time wasted on trying to change. How can I make these people different? You can't. What you can do is change the environment that people are actually in. You know?
Right. And you have a lot more influence over people's behavior when it comes to their workplace behavior specifically. Yes. And so the behavior that you should be trying to change, if you're changing behavior at all, is manager behavior, leadership behavior, the behavior of HR and occupational health and safety, the teams that are designed to support healthy work practices. Changing their behavior becomes key. Yes. And, that is the value of caring about psychological health and safety. It's a win-win.
It is.
And it's more cost efficient, right? If you can prevent people from needing care in the first place for things like burnout or work-related stress, that's a cost savings to the company, not to mention the benefits in terms of reduced rate of turnover, increased productivity and engagement, even reducing the risk that people need to take mental health leave because of work. These are all things that you don't outsource to a vendor. They're in your direct control as the employer. And that doesn't mean you may not likely need help from an outside vendor, but it does mean that you can start that work from within, and that you can monitor how you're affecting people's work-related stress over time, so that you start to treat this as something that's woven into ways of working. It's not this separate external program.
Right. So let's you hit the wave tops, if you will, on your background and expertise. So how do you end up being concerned, interested, and studying mental health? How did that happen?
Oh, wow. Yeah. So we're going way back. So it's actually a funny story. I was in my last year of my undergraduate studies, and I had done several internships in advertising, which was my major. And I cultivated this niche in consumer behavior. Why do people purchase what they purchase? Why are people loyal to certain brands? And it involved a lot of study of human behavior. And I just had this realization right before I graduated that I loved studying human behavior. I didn't love applying it to advertising and using insights about people's emotions to sell them things. So I decided, what can I do with this interest in human behavior in a way that would help me to feel like it was more pro-social, I guess. And I'm like, I guess I could become a psychologist. So I stayed another year of undergrad to do research, work in some labs, take classes, and then pivoted to a PhD program in psychology. And, I thought going into that program, I would want to become a therapist primarily, treating people for mental health conditions. I do that on the side. But along the way, I became really interested in having this more macro level impact.
Right.
And so that's what took me more towards organizational and systemic interventions.
Wow. That's so there's a part of me that, I want to espouse a lot of my kind of political beliefs about things on the podcast, but there's a part of me that's just so happy to see that someone that was probably going to get sucked into the corporate advertising system realized, you know what? Perhaps I can do some things just to help people feel better and feel better about themselves and understand the environment that they're in and make life a nicer place for people.
Yeah. That was the wide-eyed goal at the time, for sure.
Right. Absolutely. So again, what is, what's your assessment of mental health in the workplace in the United States? What's your broad kind of view of that?
I think we are making great strides in prioritizing mental health in the workplace. Let me start there. And one of the ways we see this is in the rare bright spot that came out of the pandemic, which was taking mental health out of the shadows and making it more a part of the everyday dialogue happening at work. I think at Lyra, the company I work for, we're a mental health benefits company. So all day, every day, we're talking with employers about workplace mental health. And we see that there's greater receptiveness to managers broaching mental health, to workers speaking up about mental health struggle, even executive leaders giving testimonial in high profile settings about ways in which mental health directly affects them. And so those are all great things for normalizing mental health and showing that it's a priority that we should all care about. The next evolution that I think we need to make in workplace mental health in the US is looking to our peers in other countries like Canada and UK and Australia and New Zealand for how they're looking at the workplace itself as a shaper of mental health. And this is just intuitive for those of us who work in the mental health field. Environments shape your well-being, and few environments shape us more than the workplace. And so, I think employers have caught on to the fact that, we need to talk about mental health. The conversation is happening. That means we need to make people aware of the benefits, give people some mental health literacy training. Yes, great. And now we need to talk about how work is shaping mental health and equip managers to lead in ways that reduce the risk of workplace distress, equip HR with the tools to monitor workplace well-being. I know this is in some organizations that's going to be handled by occupational health and safety, but I think in the US, from my experience, the function of assessing and addressing workplace drivers of mental health distress, it falls on HR. It just does. It does. And whether or not that's right or a good fit for their function, it's the reality. Right. And so from my perspective, we have to meet employers where they're at in terms of how they've designed this function to be addressed and equip whoever's tasked with addressing this function to do the work as systematically and as thoughtfully as possible. So for us at Lyra, it's working with HR teams, benefits teams, even L&D teams around how do you get data on how your workforce is doing, how work is affecting how they're doing, and then how do we upskill you to address the risk areas where work might be posing potential harm to people.
Yeah, I really like the approach that you described. Meeting people where they are is really important when we talk about safety in general, mental health, psychosocial hazard identification, and all of these are about meeting people where they are. Now, the hazards themselves are not discriminatory. They don't. Right. They exist. I mean, I share often that from an occupational safety and health perspective, psychosocial hazards are the one hazard that you can never totally eliminate. You cannot.
Yeah.
If there are human beings involved, you can never totally eliminate it. I can actually, there are many places where there are no chemical hazards. There are none.
Sure.
You've engineered them out. They are not an issue, period. They just are not. This is not that. This is not. If there are If there are human beings there, and if there are human beings involved, they don't have to be physically present, but if they're involved, there will be psychosocial hazards, and it's about getting people to recognize that they're there, to figure out, how vulnerable they are to that hazard, and then to figure out what, if anything, you're going to do about it. Because again, some of it is the job. I mean, I think I probably shared with you, and I share often. I spent a lot of years riding on fire trucks and going into buildings on fire and all that. You can't eliminate the hazard of buildings on fire when you're in the fire rescue service, or people shooting when you're in law enforcement, or fill in the gap. Customer service, if you're a customer-facing professional occupation. But how do you help folks be more resilient when they're exposed to that hazard of caring for other people and being concerned? So, again, this kind of advertising background. I just think that's such an interesting transition to be able to make, to look at the environment itself and how that affects. So talk a little bit more. You said earlier that environment affects how people feel and how it affects their mental health. Talk a little bit more about how that environment, what that impact looks like.
Yeah. And I love that question because it allows me to share how I became interested in psych health and safety in the first place. And it was very organically. In 2020, obviously, the pandemic is putting this overdue spotlight on employee mental health, and really helped me grow my team, because my team is focused originally on learning and development for workplaces around mental health. So mental health literacy training, mental health first aid training, and that was boom times for all of those products. But, we reached this point in like late 2021 where the topics that employers wanted to address were shifting. So we were out of the acute phase of COVID-19, and where we were addressing uncertainty and coping with distress. Then it was starting to shift more toward burnout. And now employers are wanting to address return to work and, coping with uncertainty in the workplace and curbing burnout. And my team and I started to notice a lot of these issues that employers are now wanting us to address in a webinar are really about things that are in their control. These are things that are more about the design of the work experience. And it was really us taking a look at the literature around burnout and refreshing our memory that burnout is organizational, it's systemic, it's driven by the workplace, and the way to successfully intervene in ways that also create durable outcomes is by intervening on teams, intervening within the organization. And so that's where we started to pivot more toward mitigating burnout risk through guiding employers around how to address team behaviors, manager behaviors, workplace environment factors, and even their policies. And so it's really a testament to our customers that they've been on board. We're helping some light bulbs to turn on, and people are receptive to this idea that there's more that we can do from within. And it's very energizing work for all of us, because we also address DEI and B as a topic. And again, a lot of times we're very focused on changing individual attitudes about DEI and B and doing anti-bias training and awareness training. And again, they have their place, but you can't treat them like a cure-all for
That's right.
a work environment that's not inclusive, that's not equitable.
That's right.
So increasingly, our DEI and B experts are also focused on changing aspects of the work environment itself, or helping employers to change the workplace environment itself, and to evaluate, how effective are our programs, because that's the last piece in all of this. So many programs out there, not a lot of measurement. Right. And so that's where we also want to come in and really be an advocate for not only doing training, doing programming, but making sure that it's having the intended impact.
Yeah, it kind of takes you back to, I don't know, freshman or sophomore year in college when we talked about, like Maslow's hierarchy.
Yes.
There are so many efforts focused at self-actualization and self-esteem and all these kinds of things, and they skip over that second step, which is safety.
Yeah.
People, and I say this often, people don't come to work for you because they don't feel safe coming to work for you, or they don't stay because they don't feel safe. There's something, and sometimes it is physical safety. Their physical safety is so threatened by the environment itself, and you don't change that by a program and a slogan and a poster. That doesn't, because it's about how I feel. It's about how I feel, and because as a society, at least my life experience has been, I've been in a lot of environments where I was told, you have to push past your feelings. And no, I don't need to push past my feelings. I need to identify my feelings and figure out how to take my feelings along with me, because I can't just leave them back there.
Yes. And feelings are data, right?
They are.
This is where my clinical psychologist hat comes on. We know from research that ignoring your feelings or suppressing them or pretending they're not there or trying to rapidly transform how you feel doesn't really work very well. In fact, it tends to create a rebound effect where those emotions just come back more strongly and more frequently. And that's where I think you're seeing a lot more interest in management training that helps managers identify their feelings, like you said, and harness them in ways that are valuable. So if I'm annoyed or frustrated in an interaction with a direct report, what is that data telling me?
Right.
And it doesn't mean I shouldn't be reactive to it, but I should be curious about it. I certainly shouldn't be ignoring it, because it's telling me something about our dynamic that might be posing a psychosocial risk to my employee.
That's right.
And might also be highlighting a change that I need to address in how I deal with this employee. So I love that you highlight that piece. Emotions are valuable.
Hi listeners, Jason here. We hope you're enjoying this latest podcast episode. Now, if you're like Joelle, Alicia and myself and enjoy learning from the best, then the Flourish DX Academy is for you. The Academy includes free e-learning courses on the ISO 45003 standard for psychological health and safety at work, and associated topics such as how to conduct a psychosocial risk assessment and how to create the business case for psych health and safety. All courses feature high-quality videos, downloadable resources, multi-choice questions, and a downloadable training certificate on completion. Take your learning to the next level with all Flourish DX Academy courses included within the Flourish DX mobile app. Select podcast episodes from the Psych Health and Safety podcast and sister podcasts from Canada and the USA are also included. Get started with Flourish DX for free at www.flourishdx.com/get-started. That's www.flourishdx.com/get-started. Now back to this episode.
They are. I find that, so even, and I'm not sure what type of research, whether it was, quantitative, qualitative, mixed methods, whatever it might have been. But personally, I think in the occupational safety and health space, we have tons of quantitative data and measurements and metrics around what safety is, a percentage of this and this, but we don't have enough, again, in my view, enough qualitative measures of whether or not the activities that we engage in, that we say are about safety, if they result in the ultimate goal should be, do people feel safe?
Yes.
Because if people don't feel safe, then we still have more work to do. I mean, it's not that what we're doing is good or bad or right or wrong, because we get into a lot of these, kind of value judgments on that was a good program or a bad program. Do people feel safe? And if they're saying no, there's more work to do. That's all. It's not that what we did was bad.
You're getting the perfect example of modeling psychological safety, not to be confused with psychological health and safety, but this idea of specifically learner safety, right? Like it's okay to fail. It's okay to stumble if we can learn from it. And we take what we learn and we use it in an iterative approach toward getting better. And so that, even just that piece of feeling safe, a lot of employees feel like they can't take any risks. They can't offer an idea. They can't take any initiative because if they're not right, if they don't succeed at first try, they fear a punitive response. Yes. What a risk to the company. Now you got people who feel like they can't be creative. They are fearful of being a problem solver because they don't want the responsibility of what could happen if the solution doesn't pan out. And so, all these issues of safety are intertwined, but really speak to the importance of, perception's reality. Like if employees don't perceive that they're safe, that's the metric that matters. And we need to then model what it looks like to take that information and iterate on it over time.
Yeah. And as much as, and we'll, before we leave, I certainly want to provide some opportunity for you to share how people can, bring folks like Lyra around and do business with you and all that type of thing. But much of this is much simpler than people make it. So where do I start? Ask.
Right.
Where do I start? Ask. You can hire somebody like me or like Dr. Joe. We can come and do all, but why don't you just ask people? And then, but the warning is don't ask if you're not really going to do anything with the data that you receive, because that's actually worse. And so when you're speaking about the fear that people have, and again, much of this is my own experiences and the experiences I've now started to come across is their fear is justified because the last time and the time before that, when they didn't do it perfectly, and the sad thing about what does do it perfect even mean? Right. We don't really have a policy on that. We haven't trained or talked about it before. You simply tell me after I do the thing that you didn't like it. And that somehow wasn't perfection for you. And that is a really difficult place to live, always wondering, trying to keep the boss happy. And that's not a place that is safe. That's not a place that is innovative. That's not a place that's going to continue to even survive, because there are a generation of people, some of them are even old like me, who just aren't going to do that. We spent 2 years sitting at home in some cases, reassessing our lives and reassessing what's important to us. And we've decided, you know what? I'm not going to do that. And I'm going to search and look out for environments that get it.
Oh my gosh. That is both my personal and professional experience. Personally, I am fortunate to have worked in an environment now that is very supportive of learning through trying. And that's really how my team has basically established itself and grown organically. We've learned what customers need around these different workplace issues, and we've responded accordingly in a very natural and organic way. I've also worked in environments where it really was not safe to fail. And, this is something that I have humility around, even on my own team, really trying to instill in my own management style what it looks like to set an objective, like this is what we're trying to achieve, and let me not micromanage how you get there. And I'm going to say, I have never had more empathy for micromanaging managers before than I have had since becoming a manager myself. It's hard, especially if you've built something yourself or you feel ownership for a team's output. You want to get it just so based on your own subjective sense of what's right. But, for me, trying to practice what I preach and let go of the reins and be open to ways of thinking, ways of developing programs and services that are better than what I could have come up with on my own.
Right. Yeah. Again, my observation is that we have lots and lots and lots of dialogue around how to do things. And that's where a lot of the arguments, which should be done this way, that way. And it's so much so that we forget about what we're doing or why we're doing it. We just lose track of both of those things. Why are we doing this in the first place? And what is it that success actually even looks like? And if we can stay focused, that's the part where agreement, I believe, is more necessary. The how that's what you hire qualified and trained and capable and educated. And in some cases, I had to learn this in my past experiences as a leader as well. I don't even need to know how. What I need to know is were we really clear about what it is we want to do and why we're doing it? And do I have somebody who's really skilled at it? Yeah. Well, let them figure it out, because they're probably going to do a better job than me anyway. I'm simply going to mess it up because that's just my thing. I can't be excellent at everything.
I'm sure you're excellent at most things.
I've got a couple of, honestly, I really feel there's a couple of things I'm really good at. But the other millions of things that are out there, I don't even know anything about. That's why we have other people.
Yes.
That's why you go. That's why you put the sign up. You put it out on, on some, on the web or on your website. We're looking for good people. Who goes out and says we're looking for terrible people who can't do anything?
Right. Exactly. You hire these people. So I think about this all the time. The people on my team all have expertise that I don't have.
Right.
And I need them
Yes.
to utilize that expertise in ways that I can't even foresee the best way to leverage to make the best product. So whether that's, DEI&B expertise or instructional design expertise or organizational development expertise, things that are not fully in my wheelhouse,
Right.
I need them to lead the way. And the more that I can get out of their way so that they can do that well, usually the better the product.
So let's you've mentioned a little bit about your team, and so tell us a little bit more about where you work and your team and what you do and all that type of thing. Tell us a little bit more about that.
Sure. So I work at Lyra Health, Lyra. People are often stuck on the spelling. So Lyra Health, and we're a mental health benefits company. So we work with employers to offer a full spectrum of mental health benefits. That means access to therapy, coaching, self-care apps, even medication prescribing for the full age span. So for children, teens, adults, older adults. And the idea is, what we know from plenty of research, you not only need to treat individual employees who have mental health distress, but you also need to provide that access to care for families, because if an employee is supporting a family member who has mental health concerns, it takes a toll on them too, and it takes a toll on their ability to work. So that's the focus of what we do. But my team is unique in that we are focused on the workplace and how employers can design mentally healthy management practices and corporate policies and mental health literacy training and learning and development programs, all in service of creating a mentally healthy culture at work, and also a culture that weaves DEI&B through all aspects of working. So our unique focus is on really three topic areas. So that's mental health promotion in the workplace, organizational development in mental health, how we design, work to be mentally healthy and reduce risk of harm, and then DEI&B, how DEI&B intersect in the workplace. And we equip employers to recognize that different groups within a company are going to experience mental health in unique ways.
Yes. That's actually exciting. It's exciting to know that there are folks, again, within the United States that are having this conversation. Because as you mentioned before, I mean, there are folks all over the world. And I say this a lot, and I think some folks might interpret this to suggest that everybody else is, they don't have the same issues. They have the same issues that we have. They really do. As a matter of fact, in some countries where they have the policies in place, they have the same problem. It just seems worse because they're spending more time talking about it. So it's not a panacea in that, there's a standard or a policy in place, but it's just really heartening to know that we're not really as far behind. And the other thing I believe is the fact that we, again, U.S. centric, we have the opportunity to move forward a lot quicker than a lot of other places because of their experience. We'll have to repeat that. I mean, we can look at what they've done in, again, Canada, UK, Australia, other places around the country, around the world. They've already done some of the research already have some of the examples about what doesn't work and what does. And we can simply build off that. I have no problem, using other people's issues so I don't have to have the same ones.
Right. And hopefully they would feel the same way.
That's right.
I think what you're exactly right. And what other countries are ahead of us on that's most important is really frameworks, like giving language to these things, like organizing these concepts in something that's, understandable and something they can take action on. And the action is always going to be specific to the local context anyway.
Yes.
So it's not like, any one country has the perfect playbook on this. It's really every individual company is going to have their playbook for this.
That's right. And for some people, and again, I'm surmising this based on some of the responses I get when I start talking about, psychosocial hazards. What is that?
Right.
And so the definition and my research is a psychosocial factor that's perceived or experienced by the individual exposed as a threat to them that in turn affects their behavior. I believe that this goes down to the individual person.
Yeah.
Each individual, regardless to their age, their background, their gender identity, all these type of other, ways in which our brains are formed or the environment is formed around us, all that causes us to just see things differently. And the difference is not a deficiency. It is simply a difference. And how do we, get off of this mindset that says there is one way to do it and that's got to work for everybody? Well, no, there isn't one. Now, is the goal of helping people feel safe? That's wonderful. But how I get there, it just depends.
This feels like we've come full circle because that's what implementation science is all about. Here's what research says can be effective. Now, how do we take that and make it actually feasible and effective in a setting that isn't exactly the same as the one the research study was conducted in? So everything needs to be adapted in a local context in ways that make sense for the people in that context, in the system that they work in.
Yeah, absolutely. So wow. This is the nice thing again about talking to guys like you. Again, guys like you here in the U.S. that actually know what ISO 45003 are, and they know the difference between these concepts. So share a little bit. There is, I believe, a bit of almost a trendiness about psychological safety now. And, I one of these days, that's going to be if I could, get Dr. Edmondson on to talk about that. But I think what's happening is that people are taking that concept and isolating it and suggesting, well, if we have psychological safety, it's all going to be okay. It is a part of it. It is a wonderful, almost nirvana kind of state when I can actually bring my whole self and not have to worry. The challenge is, A, how do I get there if I'm not there? And B, even more important, how do you stay there? Because as soon as you change people, as soon as you get new policies or the business gets sold or, the world changes around you, you're in this constant state of reassessment of what that actually looks like. So talk a little bit about the difference or the connection between the whole psychological safety concept and the mental health piece, because they're certainly connected, but they're just not necessarily the exact same thing.
Yes. It's funny you asked this. Our wonderful content marketing team just developed a brief guide on psychological safety versus psychological health and safety that I'm so grateful to them for. And the gist is you're right. Psychological safety is this ideal state where everyone feels like they can speak up, be their full selves, be fully authentic, and not fear punitive treatment or punishment or judgment. Now, that is different than psychological health and safety, which I think of as more concrete and tactical. Psychological health and safety is about very specific known risks and hazards, like lack of role clarity, lack of supervisor support, work overload, bullying and harassment. These are the kinds of individual issues that are pretty easy and straightforward to assess, and typically have some strategies or tactics that you can implement that can also be straightforward. Doesn't mean you won't have to adapt them to your local context, but there's a lot out there about how to address those things. Psychological health and psychological safety, in contrast, is a little more nebulous. And it's a little more nuanced because you're dealing with cultural norms and attitudes and, shifting people's, behavior in the workplace that kind of signals we've created a new norm on the team. And, Amy Edmondson has a lot of great, ideas for how to promote that. But I think it's a little more nebulous. It's a little more relational then psych health and safety, which again, I think it was very like concrete. Not to say it's not nuanced in how you address it, but you can list out the risk factors pretty easily and start measuring them tomorrow.
Well, yeah, and I've said this a lot as I've had more birthdays, that I'm less interested in these kind of binary choices. It's either this or that. No, it's actually both. I mean,
it's both. Yeah.
You can't, at least in my opinion, you cannot do one or the other. You have to do one and the other for either of them to work. You will never get and sustain an environment of psychological safety without a system of psychological health and safety. And in the middle, there are psychosocial hazards and risks that have to be identified. I mean, it is not all nebulous, but some of it is. It is not all clear, but some of it is. And it's having just that whole that freedom to be able to kind of move back and forth and not, we're in either. It's not a camp. It's an environment. And if you work at both, you're going to get the benefits of both.
That's right.
I just think that's really so, which is, it's also so important to have, again, folks such as yourself who have the clinical background, expertise, and education to be able to connect it to something that's really physical, because we do have, of course, mental health is this kind of continuum, and we do have some people, some of it because of the exposure at work, some at home, that are actually developing real physical, mental, and then physical, ailments as a result of how they're treated. And it seems to me, that's when we start to notice, but why not? Why didn't we check this upstream? Why did we wait until the person brought a gun to work or committed suicide or developed cancer or some other type of physical ailment that's also going to cost you quite a bit? Yeah. And we could have alleviated this on the front end. In some cases, we could have done it for free.
Right. And if you have a psychologically safe workplace, you're going to get people who will speak up versus feel like they have to stay quiet because it might be a punitive response if they point out a risk or hazard in the workplace that could be potentially costly, not just for an employee, but for the business. So, you're right. The psych health and safety and psych safety work together. You want to create the kind of environment where people will speak up when they experience these risks, when they see these hazards, and, ideally help an employer catch these things early on so they don't suffer the costly downstream effects.
Absolutely. Well, again, as I said, we could carry this on for a while, but in the interest of all the folks' time who have stopped taking their lunch hour or whatever to maybe listen in a little bit of a conclusion, share with folks if they want to learn a little bit more about the work that you do and the work that you all do at Lyra. How would they dig more into that? How do they get a hold of you? How do they find, the work that you all are doing? Just share a little bit of that with folks who are listening and watching.
Yes. Yeah. If you're interested in learning more, I'd encourage you to visit our website, lyrahealth.com, Lyra health.com. And my team has its own product page. It's the workforce transformation page under the Our Impact section. And that's my team, the Workforce Transformation Team. You can learn more about our products, our services, what we do. And on that site, you can also request a demo from us or request to talk with us. And we're certainly always glad to talk to anybody who has interest in addressing psychosocial hazards and risks in the workplace.
Absolutely. So last closing thought from you, anything you want to share that we haven't talked about, you want to leave with the folks who are listening and watching?
I would just say too often we talk about mental health support for the individual and mental health woven into the company and organization as a false dichotomy. Like, either we're investing in individual mental health services or we're investing in psychosocial risk mitigation and organizational approaches to mental health. That's a false dichotomy. The investment should be in both. And those things are interdependent. So whether it's the World Health Organization or the U.S. Surgeon General, all of these reports that are coming out providing recommendations to employers on workplace mental health, make it clear that individual well-being and organizational approaches to well-being work best when they're intertwined. And so that's what we're trying to do at Lyra. Make sure that an individual who has mental health needs has access to care. Make sure that employers do their part to prevent unnecessary risk to workplace mental health issues and to intervene early when some of those risks are already in play.
Absolutely. Well, Joe, I certainly appreciate the time. I appreciate you sharing your wealth of wisdom with me and with the folks who've tuned in today. And for those, again, who are, if you're listening, wherever you get your podcast, please do join us. Every single week, we come out with a new episode with a new guest talking about some aspect of psychological health and safety from a U.S. perspective. You can certainly follow us on LinkedIn. A lot of us are very active there, both me personally and Dr. Joe as well. Some of you may have decided you wanted to watch us on the Flourish DX YouTube page. And if you do, go ahead and like and subscribe. Most of the folks who tune in tend to listen, but if you want to watch, we're certainly happy to have you do that as well. And ultimately, if there's anything that either of us can do to help you on that journey, please reach out. I want to believe that everyone that I get on as a guest on the podcast becomes a part of this big family that's trying to see a different kind of environment in the United States as it relates to psychological health and safety. We can do this, but it's going to take all of us. It's going to take all of our contributions. It's going to take your contribution as well. And your contribution may be just simply listening and working with someone in your workplace or taking the time to care for a coworker. So again, thanks very much. We hope you've learned something, because I certainly have. And we'll look forward to chatting with our next guest next week on our next episode of the Psych Health and Safety USA podcast. Thanks very much. You've been listening to the Psych Health and Safety USA podcast. To stay up to date with the best content on workplace mental health in America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.